Well, hello and welcome. This is BJ Murphy, publisher of Neuse.com, and thank you so much for jumping on to this live coronavirus chat this afternoon. We have a very special guest who has been much in demand today because of the breaking news here in Lenoir County. Lenoir County has confirmed that they have their first case of coronavirus. And look, if you subscribe to our breaking news text alert message system, then you got that alert this afternoon. If you're not subscribed to that yet, we just announced it yesterday. We've had roughly 100 people or so have already jumped on it. Just text the keyword NN to 484848. Again, that's text the word NN to 484848, and you can get that information as soon as we publish it. In fact, before we even posted it to Facebook this afternoon, that information was out there. As of this morning, at 9:45 this morning, there were 398 cases in the state of North Carolina, according to the North Carolina Department of Health and Human Services. Some reports say that number is now up to 475 because they add as the day goes on, and the official release of results are released the following morning. So tomorrow morning we'll know the next number. But this morning there were 398 cases, still no confirmed deaths as of this morning across our state. In fact, we have our very first case here in our own backyard. Still zero in Greene County and Jones County as what I'm aware as of this moment. But this is moving very fast if you think about how much our lives have changed in the past week and a half. It's pretty amazing. But I do need to make sure that you know that Governor Cooper issued an executive order yesterday. This was really important, kind of a broad order that effective on Wednesday, March 25th at 5 p.m. Again, dining facilities may operate as they have, which is basically no indoor seating. But places that need to close are bingo parlors, bowling alleys, indoor exercise facilities, health clubs, pools, live performance venues, movie theaters, skating rinks, spas, sweepstakes types of businesses, arcades. All those have to close. In fact, he also restricted from, it was 100 people maximum at a gathering to now it's no more than 50 people. And also some other places that have some changes, and that includes personal care and grooming businesses like a barbershop, a beauty salon, hair salon, massage parlor, tattoo parlors. All those places need to be closed down by Wednesday at 5 p.m. Folks, this is really serious, or else the governor, the president, and even our local officials wouldn't be issuing these types of not just warnings, but actually telling you that you can't do any more business because of the health of not just you, but everybody else that is affected. And speaking of some changes, UNC Lenoir Hospital announced some changes yesterday, and that was basically that because of the coronavirus, that they're limiting the number of visitors and for what people, for what kind of patients. So basically, visitors are not permitted for inpatient areas until further notice. Any visitors under 18 years old are still not allowed, and visitors older than 85 not allowed. Pregnant or are immunocompromised, I'd never seen that word until yesterday, are strongly encouraged not to visit. Again, just everything just in order to make sure that you are taken care of. In fact, they've got some procedures in place, such as FaceTime and Skype, so you can have some kind of virtual visitation. And I know our education system is getting a full load of that right now. But if you reach out to the hospital, and they'll help you coordinate that. So that was an update from UNC Lenoir. Also, as we mentioned here, and had a video this past week with Casey Stevens with the American Red Cross. Tomorrow, Wednesday, at Lenoir County Cooperative Extension Office, there's a blood drive. There's a huge need for blood, still not just in our area, but across the country. And they really could use that blood. So Wednesday, Lenoir County Cooperative Extension Office, Friday, Deep Run First Baptist Church. Go to Neuse.com, and in the search bar, just type in Red Cross, and you'll see the article pop up. And yes, there are precautions taken to protect everybody with COVID-19, which is the reason why they want you to pre-register before you come. So please make sure you go to Neuse.com, search for a Red Cross, find that article, and then go ahead and pre-register for that event. these two events, or one or the other. Look, join us on our We Report News Facebook groups. A lot happening there. In fact, if you want to chip in to help Neuse, we've got some really cool T-shirts. We've ordered them. They should be here in the next few days and printed, and you can just chip in whatever you want. Just go to newsnews.com/T-shirts. Really cool, really hot design. Really excited about it. And the coronavirus update, we have a coronavirus specific page dedicated to it. Just go to news.news/CV. And as I mentioned earlier, we have our first confirmed case of the coronavirus in Lenoir County, and I'm really pleased to have with me Ms. Pamela Brown, the director of Lenoir County Health Department. Please share this broadcast so you can hear more from what she's got to say here right now. But Ms. Brown, this has been a busy time for you over the past couple weeks or more, and certainly today is no stranger to that fact. Thank you for joining us.
Thank you.
So tell us a little bit about your press release that we announced this afternoon, that Lenoir County identifies first case of COVID-19.
Yes, well, we had been doing testing in the community for several weeks, and today we were notified that we had our first lab-confirmed positive case. This case was confirmed in a traveler that we had been following now since last week, and had been again instructed to isolate at home, awaiting test results. And so we're pleased that this is somebody that was not again out in the community, but was in the home awaiting test results.
And you mentioned that you were notified. I know a question that some people have is, how does the actual testing happen? What is the procedure there?
Sure. Well, when somebody is a candidate for testing, and again, the state opened this up for multiple folks to be able to test a few weeks ago. So initially, if you remember, when cases first started to pop up in the United States, most of the testing was done through the CDC lab at the federal level. And then some of the state public health labs were able to come on board and start doing testing within the state. And then some of the private labs or were able to start doing testing. So it kind of depends. Different providers within the community use different labs to process their tests. And so, but any positive tests the health department has to be notified per a change in the state requirements a few weeks ago. Just like we track positive cases of tuberculosis or measles or something like that, this is something else that we need to be notified if there's a positive case.
Are you also notified if a test actually happens too?
As testing becomes more widespread, that becomes a little bit more of a challenge, especially now that any provider can order a test. We are trying to stay in touch with the providers in the community, so we kind of know the testing that's being done. But obviously, if a provider chooses to do a number of tests one day, they may not be able. The requirement is to notify us for a positive test. Again, we're trying to keep our handle on what's going on. So, but it's not always guaranteed that we might get a phone call about, hey, we've submitted this many samples today, especially if that provider is really busy.
Yeah, and I noticed in the press release, you said this resident reported travel and symptoms to a local provider who ordered the test, and at that time, a quarantine was initiated for the entire household to prevent community spread. What can you say about I would almost call them heroics of our frontline physicians and nursing staff? What can you say about the protections in place for them as they administer these tests?
Well, definitely the things that our providers are doing are just phenomenal. This is a novel coronavirus, and which means that there are some unknowns. There are some things that we don't know about it, and so these folks that are collecting the samples and seeing the patients and ensuring the patients have the care that they need. Our frontline staff, whether they be in a hospital or a doctor's office or an EMS paramedic, definitely they deserve our support for the work that they're doing to keep this community safe.
No, I agree 100%. We definitely appreciate them and appreciate the folks in your profession. I know that I'll ask you a couple of simple questions just because I feel like I know the answer, but just because they've been asked, I think it's certainly worth giving you an opportunity. One is, will you release the name and workplace of the individual or individuals in the future? Hopefully not, but just in case, of people who test positive for the coronavirus.
No, again, just because we have a public health emergency does not mean that we can waive all of the HIPAA rules about confidentiality. So typically, what we do in public health is we will message things that people can do um, th- so that they can take steps to protect themselves and their families, and that's really where our messaging will focus.
And the other one was, if you feel like, well, let's talk about symptoms for a second. What are some of the most common symptoms with the coronavirus? I mean, we're still in allergy and flu season, and I've heard a lot of similarities there, but what are some of the most common symptoms associated with the coronavirus?
So for this particular coronavirus, the typical symptoms that we're noticing are a fever that's over 100.4, and also some type of respiratory condition, for example, a cough. Um, so those are some of the most common symptoms. But again, those symptoms mirror other conditions that are going around in our community right now, such as allergies or
Right.
asthma or flu. And of course, our flu season has been extended a little bit this year just because of the number of flu cases that we're still seeing, even though we're in March. So there are just a lot of things that are out there this particular year that might have similar symptoms.
I know I was in the grocery store the other day and I coughed in the line, and it made me feel kind of like weird. Like this is such a normal thing to do, is to cough or sneeze. And I mean, I kind of just felt gross. Like I don't want people looking at me. I'm okay. But think about that, as we go out in the public and as we are, we're definitely reducing how much we're doing together. Can you help us define social distancing for us? Because I know that's a new buzzword that's going around across the entire country. Tell us exactly what is social distancing.
Sure. Well, social distancing is a strategy. It's a proven public health strategy to reduce or to slow down the spread of a disease. And what we're really asking people to do is just to keep their distance from other folks. So, again, there may be a number of folks that might be in a grocery store, but we want you to distance yourself from the person that's maybe down the aisle from you. So, when we talk about close contact for this COVID-19, the CDC guidance is we're looking to keep ourselves more than 6 foot away. So a close contact is considered somebody who has been within 6 foot of another person for 10 minutes or longer. So just minimizing that time around other folks and also keeping a longer distance, a more than 6 foot distance from people is very, very useful at this time.
Absolutely. And if you're just now joining us, we are joined today by Pamela Brown, the Health Department, Lenoir County Health Department Director. Lenoir County issued their press release today that said that they had their first confirmed case of the COVID-19, the coronavirus. And I'm really happy to have you here. Just a few more questions for you. Do you have an idea of how many tests have already been done in Lenoir County?
The testing in Lenore County has been going on for several weeks now. But again, if you remember a few weeks ago, the state made that announcement that there were other labs that were coming on board to do the testing, and that the testing would not just go through health departments or through hospitals, but also they could be ordered by providers. Providers could order tests. And when the testing becomes a little bit more widespread, when other people are involved and with other labs are involved, it's hard to keep a handle on exactly how much testing is doing. But we are monitoring as much as we can, and with our partners, we're monitoring again to see what those results are. And today we did get that positive result.
All right. So there's and we've known, because you and I spoke a week ago, that we're not dummies to this idea that there's a good chance we were going to have one, or certainly even more. But this goal of practicing social distancing, going to the grocery store once a week instead of every other day, going to get gas, every other week if you can help it, instead of, twice a week, just little things that we can do so that we're not coming in contact with each other as much. And that's been very difficult for us. It's very, very difficult for my kids. Very difficult for Aletha that works with me in the office. She's a social butterfly. And for those who enjoy going out to a late afternoon drink, those kind of things are changing our life. So I know it's difficult, but those kind of things actually help reduce people's contact. So a question from our audience was about the provider. So if a provider has somebody test positive, do the patients that go to that provider, are they also notified as well? I mean, how much notification how far do the tentacles of notification spread out?
A lot of it depends on the situation. So, for example, when we first started to see cases in the United States and in North Carolina, um, most particularly they were in travelers. That's where we started to see some of the first cases. And oftentimes, if we had a traveler that became positive, we would do that contact tracing. Who have they been around? Who have they come in contact with? And if it was an extended contact where we thought that there could be some risk to that person would be notified, and
Okay.
that's kind of how you contain this. That's that early strategy. But now that we're seeing this become a little bit more widespread, that particular strategy is not as effective. And so it really depends on what the circumstances were. So, for example, it could be that the provider, the person called and said, you know what, I think I'm having some symptoms. The provider spoke to them. The provider said, okay, here's what I want you to do. I want you to come at this time. We're going to put you in an isolated room. You're not going to be in the waiting room. You're not going to be around other people. And we're gonna take a test. We're gonna put you through the back door, so you're not. So it really, again, when we're trying to figure out who we may need to contact, we're trying to think of folks who are in a close proximity for an extended period of time. So a lot of times, if we notify somebody that we think you're a potential contact, it's because of that exposure time and that distance. And so not everybody that maybe was in that provider's office the same day that this person received a test may even be a person that needs to be notified, because the measures might have been taken to protect the other folks that were in that office at that time.
And thank you so much. And I just noticed I can still hear you, but I'm having a glitch on my video feed. Travis, send me a message, just make sure that we're still good on my end, because I can still hear Miss Brown. I just noticed it was frozen there. Yeah, there she comes back. Okay. I just want to make sure we hadn't lost there. There was a question. Apparently, that you had an earlier kind of a live Facebook Live where you took a few questions, and somewhere around the 4 or 5 minute mark, you mentioned that now that we have a few more cases, are you concerned that we might have more cases in Lenoir County, or were you speaking to the state as a whole having more cases?
Right, thinking about the state as a whole, and I think the people that have been tracking this can see that our number has been trending up. A little bit slowly. So again, we're trying to keep a very good handle on what's going on in Lenoir County, but when you're talking about a communicable disease, you can't shut off a border per se, or put up a
Mm-hmm.
barrier. So we're part
Right.
of that state effort as well.
And one thing I've noticed with the NCDHS numbers is that certainly the way it's reported, it says number of confirmed cases, and then it says number of deaths, and then it says number of tests or something like that. And when I look at that, and I noticed this yesterday, that number is always going to rise. That right now, DHHS is not reporting number of people who've actually overcome this virus. So the assumption right now is that once you got it, you still have it, but that's not the case, is it?
That's correct. And again, there's always the challenge about what is the number that's going to be meaningful, and especially that number that is going to be meaningful to a wider audience. But you are correct. We are now weeks into this, and for most people, their symptoms are going to clear up within that 14 days. They're going to become symptom free. So we're reaching a period now where people who may have been put on isolation or quarantine are coming out of it. They've been
Hmm.
symptom free for days or maybe even weeks now. So again, we're going to start to see recovered cases.
So, for example, like this positive case we have here, this individual was tested on the 17th. It is now a week later. So, and that person, the moment there was some suspicion there, they were quarantined with their family, tested. It's been a week now since that happened. And so that would mean that as long as they're symptom free over the next 7 days, statistically, they have overcome this virus and they're okay to get out of the house, correct? Or am I wrong on that?
Yes, and that is correct. And I think that that's a really good point to make. That for the majority of people, this is going to be an illness with mild symptoms, and for most people, it's something that's going to be able to be just handled at home, just as you would some other mild illness. But there are some things that we're asking people to think about before they resume normal activities. So typically, they're given that 14-day quarantine or isolation just because we know that within that time, symptoms generally will have developed and will have resolved. But if people really want to know, I didn't have to go to my doctor recommended that I just stay at home. And so, is it okay for me to go back out in public? Then if people could ask themselves three questions. Number one, has it been at least 7 days since you first had symptoms? Number two, have you been without fever for at least 3 days, so 72 hours without taking any medication to reduce your fever? And number three, are your other symptoms improved? And if you can answer yes to those questions, it is okay to go back to normal activities. But if somebody's unsure, they can definitely check with their provider for additional guidance.
So, and just to kind of go back through, if you feel like you've got these symptoms, the very first thing you want to do is either call your medical physician, whether it's UNC Lenore or Vidant, or actually call your actual primary care provider. Correct?
That is correct. Because again, a lot of folks are going to have mild symptoms. And if that's the case, the provider might say to you, if you're having mild symptoms and those can be managed at home, we just want you to stay at home and call us
Right.
if anything changes. And by doing that, what you do is you have people that are not going into the waiting room of a provider's office, where if they did happen to have something, they could share it with others that are there, or whoever's in that waiting room could share whatever illness they have. And so, again, if we could
Right.
kind of keep people out of those situations, especially if they have something that's very mild, that's going to resolve within a few days and they can handle it at home.
And look, if you don't mind, if you're watching this, please share, because we've been talking about some very important topics here. Please share this with somebody that's in your Facebook timeline as well, because there's some information that Ms. Brown has just said and has said over the last 10, 15 minutes or so that is very vital, that we really need to make sure we're educating folks, because I've seen a lot of rumors. And we definitely got to make sure that we set the record straight. So if you don't mind, do me something fun and just throw a few hearts out there for Miss Brown for the work that she and her team and all of our medical professionals are doing. Just to clarify, there was the question as we talked about this one individual where it's been 7 days. They've got to be on quarantine for at least another 7 days. Are they retested at the end of that 2-week period by chance?
Not necessarily. Again, a provider can make a determination based on what he or she feels, but not necessarily. So we're really looking for that symptom resolution and that symptom resolution to have been accomplished over a period of time. And that's
Right.
the general guidance for right now. So you don't necessarily need a confirmation that you are now COVID-19 free.
And I know for some people, they may not like that answer, but my assumption is, I just ask you, that's based on the science that we have been reviewing over the last several months, correct?
Exactly. And of course, there's a lot of research that still needs to be done on this coronavirus. It's called a novel coronavirus because it's new to humans. And that's
Mhm.
why, we're so concerned about the spread of it because we just don't have, humans don't have immunity to it. And that's why you see a lot of cases throughout the world. But there are things that we can do to slow it down or to stop the spread. And that's why we really need the public's engagement in this to practice that
Mhm.
social distancing and just to be home as much as possible. And if they've got very mild symptoms to stay at home and take care of those symptoms on their own. And that way we preserve our medical resources and our medical system for those who may have more significant symptoms or may have something else that's going on that's not even COVID-19 related where they really need to utilize that emergency department. So we want to preserve
Nah.
those resources and that PPE. We don't want somebody that has very mild symptoms going into the emergency department and it takes a mask, that provider needs to mask up. They need to use some other resources, and then that might strain our system later on when we have some more severe cases.
Right, which we've probably seen a rise. Tomorrow afternoon, I'm going to at 4 p.m. We're going to have Dr. Parrish, the Claire Parrish, the chief medical officer at UNC Lenore, is going to be in this seat as well with me on this coronavirus chat. So I'm looking forward to having Dr. Parrish with us. But I would imagine there's been a rise in telehealth, telemedicine over the last few weeks because of this, just as we've seen with the education system, with kids using Zoom and things like that to more iPad technology. Last question, and it was on the lines of the what our medical professionals need. I know that UNC Lenore, when they issued their press release yesterday, they also said that, hey, look, there's also some supplies that we need, and it was related to masks and nasal swabs are two of their most high priority items that they need. How can the public help with that? And we'll, in kind of closing on that, what else can the public do to help you and your peers in your profession?
Sure. Well, the response to this is very very much in the public's hands, and so I really appreciate the folks that have been spending more time at home and have been limiting their time that they're running errands, that have been maintaining some social distancing. There really is a lot that we can do as a community, not only to protect our health but to slow down or stop this disease and also to protect our medical infrastructure within Lenore County. So again, I just reiterate for people to stay home as much as you possibly can. To if you've got mild symptoms, to be in touch with your provider, but again, you may not need to go in to see the provider and you may not need to be tested. This might be something that you can just handle at home, and symptoms
Hmm.
will resolve in a couple of weeks. So if we can have everybody, again, this is something that we do as a community, and so if we can have everybody that helps out in this way, we can slow this, and we can protect our medical system as well. So I just really appreciate the people that have gotten on board with this. I know it's can be sometimes confusing. I know there are a lot of questions. I know that this can create some tension. It's a situation where there are a lot of unknowns, but there are so many things that we can do as a community.
Well, and I appreciate that. And if you're watching, please make sure you share this. In fact, something fun. Please tag a healthcare professional and just write the word thank you, I appreciate you, I love you, all those good things, because they really need your support right now. The medical profession is really under a lot of stress. And one of the biggest things we can do is to social distance. That is why at Neuse we're here, and Ms. Brown is in her office. And we would love to be right here face to face having this conversation like we typically do, but we realize that we need to use the technology available to us to have this very frank conversation with Ms. Brown. So thank you, Ms. Brown. Really appreciate you, and thank you so much for all you've done. And hopefully we'll get another update maybe from you over the next few days.
Thank you.
I appreciate it. And folks, if you're still with us, just want to say thank you so much for joining. And look, if you don't know this, you can actually text the keyword NN to 484848. That is our brand new breaking news alert. If you text the keyword NN to 484848, or you go to Neuse.com, you put your number in, you'll see a little box for that. When you do that, you were the first to know about this breaking news alert. We sent it to you before we ever posted it to social media. That's just a way of saying thank you for signing up to get our free text messaging alert. And as always, everything we do here at Neuse is free. If you want to chip in and help, by all means do so. We've got a really cool t-shirt we're coming out with, just neusenews.com/t-shirt. But you don't have to do that either. We're going to continue to provide this service. In fact, Dr. Travis Town is at his home office helping to produce this. So thank you, Travis. And Aletha Throwers is at the office and helping to manage the comments. So thank you also to Aletha. And look, thank you to everybody who's jumped on and asked a question, who has participated, who has shared. Like I said a while ago, tag a healthcare professional in the comments here and just say thank you. We appreciate you. We love you. One last thing I want to mention is that we're going to be publishing this story very soon. But Golden Leaf has announced today that they've got $15 million in funding to help small businesses with loans up to $50,000 with 0% interest for 6 months, and then it would transition over to a term loan after that. So again, the small businesses could get some assistance, up to $50,000, 0% for 6 months, and then they'll transition over to a term loan. That will be up on neusenews.com later today. And so thank you everybody for subscribing. Tag those folks. And when are the hoodies coming back? When it gets cold, when it gets cold. But look, thank you also for subscribing to our newsletter, and thank you also for subscribing to our breaking news text alert. And thank you everybody for chipping in to get those t-shirts. Y'all have a great day. Take care, and God bless.